November 14th each year is celebrated as World Diabetes Day, and this year I is the focus of World Diabetes 2016. Diabetes is a major concern in St. Vincent and the Grenadines as more cases are being confirmed on a yearly basis. The disease is no longer just connected to older persons, but it is also common among children and young adults. How much do we know about diabetes? How does it impact our bodies? What lifestyle changes do we need to reduce the risk factors of becoming a diabetic? Today, a consortium of international medical organizations is highlighting the fact that a quarter of people with diabetes are not discussing eye complications with their healthcare professionals, despite a worldwide survey indicating that vision loss is feared twice as much as other common complications of diabetes. A symposium was held at the Fisheries Conference Room by the Diabetes Association in conjunction with the Ministry of Health, Wellness and the Environment in an awareness campaign focusing on diabetes mellitus and the eyes. Here are some highlights from the day's event.
Good afternoon to everyone. Yes, I just want to say my role here is just bring some brief remarks on behalf of the Ministry of Health, Wellness and the Environment. I just want to begin by saying, according to the International Diabetes Federation, today, as we are aware, is being celebrated around the world as World Diabetes Day under the theme, Eyes on Diabetes. The focus is on promoting the importance of screening, especially for type 2, which we call adult onset diabetes, as to ensure early diagnosis and prompt treatment to reduce the risk of serious complications. The Ministry of Health, Wellness and the Environment is pleased to be partnering with the Diabetes and Hypertension Association in developing and implementing community outreach programs like this, geared at increasing awareness about diabetes and other non-communicable diseases, and the need for persons to ensure early diagnosis to reduce complications such as blindness, lower limbs amputation, heart disease, and kidney failure, just to name a few. Too many persons in St. Vincent and the Grenadines are living with type 2 diabetes for a long period of time without being aware of their condition. And by the time the condition is diagnosed, diabetes complications are already present. And this is what the Ministry of Health, Wellness and the Environment and the Diabetes and Hypertension Association are trying to avoid. We are working and will continue to work on the premise that every adult has a right to know their blood glucose level. You agree with me? Yes. Every adult has a right to know their blood glucose level. And so the ultimate goal for the Ministry of Health, and I'm sure for the Diabetes and Hypertension Association, is to reduce the number of persons living with diabetes and other non-communicable diseases in St. Vincent and the Grenadines. And this can only be done through prevention. And we have to begin with screening. Screening is where it all begins. And I want to commend you for your effort here today and to brace the inclement weather that you can join us in this symposium today. I hope by the end of this session that you will be motivated. You're already on the right path, doing the right thing, and that you will continue to make the necessary lifestyle adjustments, be it diet, exercise, and so forth, to try to control your blood glucose level. On behalf of the Ministry of Health, Wellness and the Environment, I want to wish the Diabetes and Hypertension Association a successful day in this venture, and for the rest of the week as we carry out other activities, I just want to encourage you to continue living healthy and doing the right thing. Thank you.
Let's talk about diabetes in general. So, how many types of diabetes do you think there are? 2 types? Anybody think any more? There's actually 5 types of diabetes. All right. So you have type 1 diabetes, type 2. You have gestational diabetes. You have pre-diabetes. So that's pre-diabetes. That is that diabetes that everybody thought was a little touch of sugar. And years ago we used to call it borderline. Well, I want you to know that pre-diabetes is actually very, very dangerous because it puts most patients who are have sugars higher than they put you at risk for more cardiac death. As I said earlier, once your sugars are higher, it attacks the small vessels in your heart, in your eyes, in your kidneys, and once it's attacking the small vessels in your heart, the damage is done from the inside out, so you're more likely to have cardiac death. There's a 5th type of diabetes that's called idiopathic diabetes, and the doctor that was here earlier, she mentioned that a little bit. That's the diabetes that you get from other conditions. So you get diabetes as secondary if you have lupus or if you have any autoimmune illnesses, lupus, sarcoidosis. You can get diabetes if you have asthma that's not well controlled. So a person that has bad asthma that's not properly controlled, because you have to be on steroids to help the asthma, the steroids will increase your sugars, and so we are at an imbalance. Do we take you off the steroids that's helping your body, or do we continue to give you the medication, but we have to watch to make sure that your sugars are not climbing too high? So there's actually 5 different types of diabetes. For most people, I would caution you to have your families checked for diabetes. Know the signs and symptoms of diabetes, because the pre-diabetes phase can last sometimes between 5 to 10 years. So it's 5 years, 10 years of damage that's being done, and you don't really realize that's what's happening. So some of the subtle signs, they're classic signs of diabetes, but we can look at them as subtle. So you're going to the bathroom a lot, frequent urination, right? We can always pass frequent urination off to something else. Oh, I'm going to the bathroom because I'm drinking a lot. Or I was going to the bathroom because, I was holding my urine longer than I wanted to. But frequent urination is a sign, a definite sign of diabetes. Frequent thirst. Oh, I'm thirsty a lot because it's hot outside. It's thirsty a lot because, I was peeing a lot. I'm thirsty because, I like water. I just like juice. But frequent thirst is a classic sign of diabetes. Weight loss. So a person that's having unintentional weight loss, so you're not trying to lose the weight. If you're losing the weight, sometimes it's because you have symptoms of diabetes. Infections. If you're feeling fatigued a lot, if you have dry, itchy skins, those are classic symptoms of diabetes. So why do some of those classic symptoms happen? So if I have frequent urination, what happens is diabetes is a disease where I just have too much sugar in my blood. All right? If you don't have diabetes, whatever you eat is broken down into sugar because your body needs the sugar for energy. So you'll eat, your brain says, oh, she just ate, break it down into sugar, and then your pancreas, which gives you the insulin, will say, match the sugar with insulin so that my body can use this now to go into my cells. When I have diabetes, I don't have that match. So I have a mismatch between the insulin and the sugar. So I have all this extra sugar running around my body. How does my body get rid of it? It gets rid of it through the urination. So my body is trying to get rid of all that sugar so it comes off as urine. But because now my body's getting all that sugar to run off, my cells become dehydrated and I get thirsty. So that's why I'm drinking more of the water, because I need my cells to be rehydrated. Once your cells are dehydrated, your sugars are going to go up. All right? If I'm not able to take have the sugar match with the insulin match, then I don't get the nutrients into my cells the way I need to. And because I'm peeing them off, my body lacks that nutrient, so I'm going to lose some of the weight. If you were just diagnosed with diabetes and you was losing 10 to 20 pounds, I will know that your sugar is getting better when I start to see you putting back the weight on, because I know that your body is taking the nutrients that it's supposed to and use them in the proper way. You get hungry a lot with diabetes, because as I said, the nutrients is not going into the cells, so it's not feeding these cells. You have hunger. Fatigue. Well, if I have to go to the bathroom all the time and I have to run to get water all the time, I'm not going to be sleeping well, I'm not going to be resting well, so you get a lot of fatigue. All right. If the sugars get very, very high, you can have a lot of confusion, and that can lead into a coma. On the opposite end, when my sugars are low, my body's going to tell me something different. So I need to know the difference between when my sugars are really, really high, because there's a different treatment for that, as to when my sugars are low, there's a different treatment for that. So when my sugars are really, really high, I need to be able to take my medication, because the medication is, what is the job of the medication? To bring my sugars down. So if my sugars are high and I'm not taking the medication, where's my sugars going to go? It's going to go up even more. I need to watch what I'm eating when if I have diabetes. All right? So what we need to understand is eating sugar and eating starch does not cause diabetes. If I have diabetes but I'm eating starch, it makes my sugars go up, but it doesn't cause diabetes. Diabetes is actually caused because I have problems with my pancreas making the amount of insulin. So most people think that, okay, if I'm eating a lot of sugar, if I'm eating a lot of starch, I'm going to get diabetes. But think about it. Everyone all over the world eats starch. If I go to China, they're going to give me what? They might give me some rice. If I go to Italy, they're going to give me what? Pasta. If I go to Africa, what are they going to give me? Couscous and cassava. If I come to St. Vincent, what are they going to give me? Breadfruit. All right? Does everybody in St. Vincent have diabetes? Everybody who eats breadfruit? No. So there's a problem with my pancreas giving me enough insulin. But if I'm eating a plate full of breadfruit, what is that going to do with my sugar? It's going to increase it up because I don't have enough insulin to cover that. Everybody understand that? Okay. When my sugars are low, my body is going to tell me a different symptoms, because my body is going to try to get me to have some kind of reaction so that I can put sugar into my body. So I'm going to get sweaty. I'm going to feel nervous. I'm going to have hunger. So hunger is there when my sugar is high as well as when my sugar is low. I'm going to get that foggy feeling where you can't really think and coordinate, all right? You're going to get a pounding heart rate. Why is that? Because your body is saying, hello, hello, listen, put some sugar in me fast, put some sugar in me fast before I fall out, okay? So how do we treat a low sugar? We treat it, it's called the 15-15 rule. I need 15 grams of carbohydrates. I need to wait for 15 minutes. I recheck my sugar, or my symptoms are relieved in 15 seconds, and then I go on. 15 grams of carbohydrate is going to be 4 ounces of juice. So when you're feeling shaky and nervous, please don't tell anybody to say, give me some juice. Because some juice for some people is this whole bottle. True. All right? And then what else? If they're giving you juice, what do they like to put in it? Sugar. So when your sugars are low, you don't need to add the extra sugar, because if you add the extra sugar, what's going to happen to your blood sugar? It's going to go sky high. So now you have the other extra problem. All you need is 4 ounces of juice. So that's half of a glass of juice. Half a glass of juice, you drink the juice. I'm going to wait for 15 minutes. If you don't wait for 15 minutes, you can eat the whole house out. Why? Because your body is craving, the body needs that energy, so your body's just going to say, eat, until it feels that the sugar has come up, but you have to wait for 15 minutes. After 15 minutes, those symptoms will you'll start to feel some relief. And then if you have a monitor, you check your sugar at that time, you will see your sugars going up.
Okay, now I am going into the diet. Okay? Now diabetes mellitus is managed in 4 different ways. So it's a 4-prong approach. Now, my name is Wendy Williams. I'm sorry, I should have said that. I work as a community nutrition officer in the Calico district. So from Sion Hill back to Stubbs. Okay? Now the management of diabetes takes a 4-prong approach. Many persons that I come in contact with have a very hard time adjusting themselves to diabetes because they come with the concept, if I pop a pill in, it's gonna take care of my diabetes. And so you have to keep repeating and letting people know that diabetes, you cannot take a 1-prong approach. You have to start with your diet. You have to exercise. You have to take your medication to help you to bring down the sugar. And because you are living with diabetes, I like that approach, Ms. Suzette, because you are living with diabetes, picture yourself as being like a brand new born baby, and that baby, if you don't take care of that baby will get sick. So look at it in that way, that you are now more susceptible to getting other complications. So I usually tell clients that at least once per year you will go for a thorough head to toe examination. Doctor will send you for tests and will check your heart, your kidneys, whatever, a thorough check. So we are looking at it in this 4-prong approach. Your diet, your exercise, taking your prescribed medication, and at least a 1-year thorough examination. Okay?
St. Vincent de Grenadines Diabetes and Hypertension Association, along with the Ministry of Health, will be and is celebrating World Diabetes Day today. Today we are right now at a symposium for our persons who have condition of diabetes and hypertension. We need to recognize that diabetes is one of the non-communicable disease, and because so many of our patients are persons in the community affected, we have to make sure that we give the community information about diabetes. The importance, however, that the theme for this year is Eyes on Diabetes, and the issue is in relation to screening, and that's why we will be having that screening, that awareness day on Friday. And this screening is to help us to identify new persons who are diabetics or persons who are already diabetic, so that we can also to eliminate some of the complications. We are asking the general public, however, to use this week to have some awareness of what is happening with them. So we are asking them to also to have screening. So visit your nearest health center or your private doctor so you can have your blood sugar done in order to ascertain if you are diabetic or if you are controlled. Wish that you will continue to take care of yourself. Remember, physical activity is a must, at least 20 minutes a day. You must also be in relation to your healthy diet, starting with a breakfast at first. Also to continue to take your medication and visit your doctor regularly.